Getting ready for labor is exciting and can be intimidating. By learning what to expect, you'll feel more empowered during your experience. Here at UC San Diego, you will labor in the same private room that you'll deliver in. You may choose who you would like to stay with you during your labor and delivery. During flu season, children may be asked to remain off the labor and delivery floor. When you first arrive to labor and delivery, you will be evaluated in a triage room, similar to an emergency room for pregnant women. Once you've been admitted to the hospital, you'll be escorted to your labor and delivery room. Your care team will monitor your labor progress with cervical examinations. If you desire an epidural, the anesthesiologist will come to your labor room for placement. Often patients are able to eat and drink freely during labor unless they have an epidural or require labor augmentation with medication. Once your cervix has become completely dilated, your provider will encourage you to start pushing. Your team will help you to learn how to push effectively, bearing down with the contractions to help move the baby through the birth canal. Pushing often takes a few hours. Think carefully about who you would like in the room during this time. Who will support and encourage you the most, keeping the focus and energy on you and what you need while you're pushing. Anyone else can wait in the waiting room. While your baby is delivering, your provider will be guiding and supporting you during the process to help minimize your risk of tearing. Episiotomy, or cutting the vaginal opening to widen it, is only used for emergencies. The rest of your care team will be checking your vital signs, monitoring the baby's well-being, and anticipating the needs of your provider to give you excellent care. Immediately after delivery, your baby will be placed on your chest, ideally in a skin-to-skin fashion. This will be one of the best moments of your life. By keeping your baby directly on your skin, you will also be helping to keep her warm and enhance her sense of safety with your sounds, smell, and person. This also helps with nursing, and sometimes your baby will start to nurse right away. Don't worry if your baby takes a little while to learn to nurse. Our lactation team is available to help, and all the nurses and providers are trained as well. Your care team will be evaluating your baby carefully while she's with you to make sure that she's transitioning well. We routinely perform delayed cord clamping, which allows your baby to get as much of the blood supply as possible before clamping and cutting the cord. Your provider will clamp the cord and encourage you or your support person to cut the cord while your baby is still skin to skin. You'll then be given a medication that helps prevent postpartum bleeding, and your provider will help you to deliver the afterbirth, called the placenta. If you do have a small tear, which is common, especially in first-time mothers, your provider will make sure that you have sufficient pain medication, usually with a local injection around the area, prior to suturing the tear. Absorbable sutures are used, which will be gone by about 4 to 6 weeks without having to be removed. Your team will then help get you comfortable for nursing your baby. Ideally, you'll be able to continue uninterrupted skin-to-skin time with your baby for at least 30 minutes. Please encourage your loved ones to resist the urge to interrupt this precious time. After a few hours recovery period, you and your baby will be escorted to your postpartum room, where you will both complete your hospital stay together until discharge. If at any point during delivery or postpartum your team is concerned for your baby's health, they may recommend further assessment in the baby warmer in your room or potentially a short stay in the neonatal intensive care unit, or NICU. Your team will always explain what the concerns are and why temporary separation may be necessary. You may designate someone to be with your baby if you're recovering and unable to personally go with your baby to the NICU. Once you have recovered, you have 24/7 access to your baby in the NICU. Throughout your delivery, please ask questions or voice concerns or desires. This is your delivery, and as your treatment team, we want this to be the best experience it can be while ensuring the ultimate goal of healthy mom and healthy baby.